Hi, can you tell us your name and what brought you in originally to see us?
I'm Geraldine Steffen, and I've been having problems. My doctor had diagnosed me with hypothyroidism, and I was on medication for that, but I was still feeling a lot of thyroid type symptoms, and I saw an ad on TV with Dr. Stuckey, and it sounded like what I was having problems with, and so I followed up with a phone call on that.
Do you remember, Jerry, do you remember what some of your symptoms were that you were suffering from?
My hair was getting thin, my skin was very dry and itchy, and I had never felt cold before, but my hands and feet were always cold and sometimes generally cold.
Yeah.
I was having a lot of trouble sleeping, and my joints ached, especially my hips and knees. I had problems with a lot of abdominal pain, and nobody could seem to pinpoint any reason for all those pains. X-rays didn't show anything on my joints, and they said, well, you're just having irritable bowel.
Yeah. Do you remember what your energy level was like back before?
I was very tired. I would start a project and I'd sit down to relax halfway through because I couldn't finish it. I was too tired. I'm just feeling exhausted and generally not sick, but I just didn't feel well.
Mm-hmm. Do you remember what we found out when we did your thyroid testing?
The thyroid testing, the TSH was in normal range, but everything was not where it should have been, and especially the antibodies were very high.
Right, so we found out your immune system was actually attacking your thyroid, and that means that you have the Hasimoto's. Yeah.
Disease, yes.
So now we've had you doing the autoimmune protocol for a while.
Yes.
And how has that affected you now? How do you feel now?
Actually, I feel a whole lot better now. I have a lot more energy. I'm sleeping better. I still have occasional nights where I can't sleep. I wake up partway through the night and can't get back to sleep, but that's very seldom. I can actually get a decent night's sleep, so I can keep going the next day. Now when I start things, I can finish them. I think the nicest thing is I don't have any more gut pain. I don't have any more aches in the joints. The skin is a little improved. It's not quite so itchy and dry anymore. I haven't noticed anything with the hair yet, but I'm hoping that's okay, and I have lost some weight.
Good, excellent. Does it feel like your inflammation has come down or your immune system has like settled down quite a bit?
Yes, and I think one of the things is that this is the only place in which I was tested for intestinal parasites, which they did find. I got rid of those little boogers, and that has helped a lot. I don't have any more of the diarrhea like I had constantly before.
Good, good. So now everything is like regular again?
Right.
Excellent, excellent. What would you say to somebody who has thyroid symptoms? Maybe they're taking thyroid medication and they don't really feel well, or maybe the medication's not helping them. Would you recommend a program such as this for them?
Definitely, because my medical doctor was saying, well, there's nothing wrong with your thyroid because your TSH is normal, and I had asked him to check my T3, T4 antibodies, and it was never done. And yes, I would definitely recommend this.
Yeah, good, good. Anything else you'd like to talk about with your management or how you've done so far? And
I think it's a good program. It hasn't overloaded me with a lot of medication. That's what I'd like to get away from. And I've been told that there's probably a good chance in the future that Dr. Stuckey would be able to decrease my dependence on metformin and other things for my diabetes, that my insulin resistance would also be changed around.
What do we have you working on right now? We just talked.
That's what I'm working on right now, is to get that checked, to check my actual sugar levels more times during the day, to work on that, and then start this protocol.
Yeah, we're going to get your blood sugar down, and
That'd be awesome.
yeah, great. Well, Jerry, I appreciate you spending some time with us. You've done really well, and you've been an excellent patient, so thank you very much.
And thank you for helping me out. I really appreciate the improvement in my general health.
Good, thank you.